Hello and welcome. Today we're diving into a potentially serious and often overlooked condition, heavy metal nephropathy. We'll explore what it is, how it affects the kidneys, and what can be done about it. Heavy metal nephropathy is kidney damage caused by exposure to toxic heavy metals. These metals, such as lead, cadmium, mercury, arsenic, and uranium, can enter the body through various routes: ingestion of contaminated food or water, inhalation of dust or fumes, or even skin contact. Occupational exposure in industries like mining, smelting, manufacturing, and construction is a significant risk factor. Environmental contamination, such as living near hazardous waste sites, can also contribute. Sometimes, even certain traditional medicines or contaminated supplements can be a source of heavy metal exposure. The specific metal and the duration and intensity of exposure greatly influence the severity of kidney damage. Once heavy metals enter the body, they are distributed through the bloodstream and accumulate in various tissues, including the kidneys. The kidneys are particularly vulnerable because they filter large volumes of blood. Heavy metals primarily target the proximal tubules of the nephron, the functional unit of the kidney. They interfere with cellular processes like mitochondrial function, enzyme activity, and DNA replication. This leads to oxidative stress, inflammation, and cell death, specifically apoptosis and necrosis. The damage disrupts tubular reabsorption and secretion, impairing the kidney's ability to regulate electrolytes, pH, and waste products. Over time, chronic exposure can lead to interstitial fibrosis and glomerulosclerosis, resulting in a progressive decline in kidney function, eventually chronic kidney disease, or even kidney failure. The prevalence of heavy metal nephropathy is difficult to determine precisely, as it often goes undiagnosed or is attributed to other causes of kidney disease. However, it is more common in specific populations. Individuals working in industries with heavy metal exposure, those living in areas with environmental contamination, and children exposed to lead-based paint are at higher risk. Certain geographical regions with naturally occurring levels of heavy metals in the soil and water also exhibit higher rates. Studies have shown that even low-level, chronic exposure can contribute to kidney disease progression, particularly in individuals with pre-existing kidney conditions or other risk factors like hypertension and diabetes. The signs and symptoms of heavy metal nephropathy are often subtle and nonspecific, especially in the early stages. Early symptoms may include fatigue, loss of appetite, nausea, and headache. As kidney function declines, more noticeable symptoms appear, such as edema or swelling, particularly in the legs and ankles. Changes in urine output, including increased or decreased urination, and foamy urine, indicating proteinuria, can also be present. As the disease progresses, symptoms of advanced kidney disease, such as anemia, bone pain, and neurological problems, may develop. It's important to note that some individuals may be asymptomatic for a long time, making early detection challenging. Diagnosing heavy metal nephropathy involves a combination of clinical evaluation, laboratory tests, and imaging studies. A detailed history of potential heavy metal exposure is crucial. Blood and urine tests are performed to assess kidney function, including serum creatinine, blood urea nitrogen (UN), and glomerular filtration rate (GFR). Urinalysis can detect protein and other abnormalities. Heavy metal levels in blood, urine, and even hair or nails can be measured to confirm exposure. Kidney biopsy may be necessary to evaluate the extent of kidney damage and identify specific pathological features. Imaging studies like ultrasound or CT scan can rule out other causes of kidney disease and assess the size and structure of the kidneys. While heavy metal nephropathy doesn't have strict classifications like some other diseases, it can be categorized based on the specific heavy metal involved, such as lead nephropathy, cadmium nephropathy, or mercury nephropathy. The severity of the kidney damage can also be graded based on the stage of chronic kidney disease, ranging from mild kidney damage with normal or near normal GFR to end-stage renal disease requiring dialysis or kidney transplantation. Furthermore, the pattern of kidney injury, whether primarily affecting the tubules or the glomeruli, can provide valuable diagnostic and prognostic information. The primary goal of treatment for heavy metal nephropathy is to minimize further exposure to the offending metal and to support kidney function. Chelation therapy, using agents like EDTA or DMSA, can help remove heavy metals from the body. However, chelation can also have side effects and is not always effective, especially in chronic cases. Supportive care includes managing blood pressure, controlling diabetes, and restricting dietary protein and salt intake to slow the progression of kidney disease. In advanced cases, dialysis or kidney transplantation may be necessary to sustain life. Preventing heavy metal nephropathy is crucial. This involves reducing exposure to heavy metals in the environment and workplace. Occupational safety measures such as proper ventilation, protective equipment, and regular monitoring of workers are essential. Public health initiatives to reduce lead exposure from paint and water pipes are also important. Consuming a balanced diet, avoiding contaminated food and water, and being cautious with traditional medicines and supplements can also help minimize exposure. Regular monitoring of kidney function is recommended for individuals at high risk. The prognosis for heavy metal nephropathy depends on several factors, including the type of metal involved, the duration and intensity of exposure, the severity of kidney damage, and the effectiveness of treatment. Early diagnosis and intervention can significantly improve outcomes. Some recent research focuses on developing more effective and less toxic chelation agents. Other studies are investigating the role of antioxidants and anti-inflammatory therapies in protecting against heavy metal-induced kidney damage. Furthermore, research into biomarkers for early detection and risk assessment is ongoing, aiming to identify individuals at risk before irreversible kidney damage occurs. Understanding the specific mechanisms of heavy metal toxicity and developing targeted therapies remain areas of active investigation.